We all worked together for years, so we knew each other, we did good. And then COVID hit, and we went from 1 resident to 3 to 5 to whatever number. And the next thing you know, half the staff downstairs had COVID, and they were gone. So I was pulled downstairs, and I found myself day after day on a hall with 22 people, and most of them have COVID, some didn't. I did not have enough PPE. I actually wore electrician's goggles that my nephew sent me. I wore a shower cap. I put bags on my sneakers, and I ran up and down the hall all day long trying to take care of people. And it was just me by myself. Nobody came on that hall to help me unless they absolutely had to. And I had to do everything, and I couldn't. I had to leave everybody in bed, and the best I could do was run from one room to the next, making sure that people were as clean as they could be, changed, moved around. And the ones with COVID would sit up and try to talk, and they couldn't. And
Kelly, how many residents did you lose in your nursing home because of COVID?
I'm gonna guess between 7 and 9. I can't even remember the actual number. But we also, you work in the day, and you have 2 across the hall that are begging you, please don't leave me. And you lie and say, I will be right back. And you're not going to be right back. And you might be back in an hour or 2. And then the one across the hall, they come in and tell me, well, she just tested positive too, so you got to go in and tell her. And she's heartbroken because she's with it, knows what this means. And it just never stopped. And it was day after day after day. And you watched people that you'd cared for and loved die with their mouths open. And you told families that you would take care of their families. And you fear every day that you'll see a family member in public because that person died too. And once we quelled it a little bit, went back upstairs where I usually work. And a little while later, all of a sudden we had a day where they're doing the regular swabs, and one resident after the next, positive, 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 positive. They start moving them down to quarantine. Took one of the aides with them until there was nobody left. There was me and one other girl. They filled up as many as they could on the quarantine hall, and there was too many of them. So the rest of them stayed upstairs with us. At 3 o'clock, nobody showed up. The other girl left. I was there. Alarms were going off, bells were going off. I don't even know how many residents there were at that time, maybe 30 upstairs, I don't know. And I ran from room to room trying to do, my shift was done, but I just kept running from room to room until I found one of the residents. The alarm was going off. He was up out of his chair, no clothes, delirious. And he ran, grabbed me, pulled my mask off, coughed in my face. A week later, I had COVID. And I brought it home to my family, almost killed my child. Was out for 6 weeks, 2 months almost. Went back, and most of the staff didn't come back. And everybody who we hired since then don't stay. There's 3 of us on day shift that stayed. And we still run day after day after day. And there's days when you have, on a good day, you have 13 people, maybe 11 people, but you can't do what you need to do. You prioritize. Is everybody alive? Does everybody get fed? Does everybody get changed at least once or twice? No beds. You can't do linens. You can't do you can't talk to people. Like Keisha said, you can't even stop and talk to people. And it's not, 20 years I've been doing this. I know what to do. I can run a floor by myself, and I can't anymore. I can't.